Good afternoon, everyone. I am Press Secretary Philomena Robertson. Good to be with you again today. We do apologize for the late start, but we had a few technical challenges that we were trying to sort out. I think they have now been rectified. Therefore, we shall commence. This afternoon's press brief is facilitated by the Ministry of Health. In the room with me, I have Health Minister Honorable Nicholas Steele and Dr. Dolan Nwell, whose substantive position is Head of Internal Medicine, but in this scenario, he is serving as Head of the COVID Clinical Management Team. In an earlier statement today, the Honorable Health Minister indicated the possibility of another COVID case. We are here this afternoon to bring you an update on that situation. Minister Steele.
To all. As I informed earlier today, we are awaiting the final confirmation of this latest case from the PCR test, which we expect to receive any minute now. As the day progressed, much more information was obtained on this individual, and there has been much talk out there. But as always, we come to you with what we know. On April 19th, a 45-year-old male was admitted to the hospital exhibiting symptoms consistent with COVID-19. A rapid test was conducted, which showed him to be negative. An X-ray was also conducted, followed by an IgG-IgM test and a subsequent rapid test, which all returned results positive with the presence of COVID-19. He is now isolated in the COVID-19 section of the hospital and is being treated for symptoms. On 2 occasions during the last week, the individual presented to the health practitioners with breathing symptoms that he reported were developed after inhaling chemicals in his line of work. He was subsequently treated and released. Until now, all confirmed cases of COVID-19 in Grenada have been imported or import-related. This current individual in question has no travel history, and currently officials are yet to determine whether he has been in contact with any of the previously confirmed cases. Health officials have been in discussions with the employer of the individual, and employees have been asked to self-isolate. All of the employees and everyone known to be in contact with this individual will be tested, consistent with the established health protocols. The investigation is still in its very early stage, but we must prepare ourselves for the possibility of a community spread of COVID-19 in Grenada. Fellow citizens, this battle against COVID-19 can be won, but only if we each do our part to protect each other. We cannot afford to be selfish in our activities, engagements, and practices, because every move we make potentially impacts our entire society. Our grandparents and those with pre-existing symptoms are depending on us to stay alive and healthy. Our children are looking to us to protect them. Our country is counting on us to band together to get out of this latest health and economic crisis and to get back on our feet. We must answer the call. Thank you.
Thank you very much, Minister Steele. We will now take questions from members of the media. In addition to Minister Steele being here, as mentioned previously, we also have Dr. Dolan Nwell, who is head of the COVID Clinical Management Team at the General Hospital. Do we have any questions yet? Mikey, you may proceed. Mikey Hutchinson, go ahead with your question. Sorry, Mikey, we're trying to resolve an issue here. We will... Okay, you may proceed now. Go ahead.
Is it unmuted now?
Yes, go ahead. Go ahead, Mikey. Ask your question. Go ahead.
Okay, all right, thanks again. All right, I have two questions. First of all, we talk a lot about community spread. And for the benefit of the general public, can we explain when we say community spread, what does that mean in layman's terms? And how would that affect us and the way we socialize and the way we do business once we can confirm? And when I say business, I mean go about our daily lives. Once we can confirm that there is community spread.
Yeah, Mikey, is a very good question. Community spread means that it's no longer what we have had so far, imported cases or import-related, i.e. somebody came in with the virus. Community spread basically means that you are at a point where individuals are being infected by individuals here in Grenada who have not traveled or have not been in direct contact with an import related. Basically would mean that we cannot trace it back to somebody that has come in, that we can simply determine the period in which they were infected, and during that period, based on the information they would have given us, that there is no one that they were in touch with that recently traveled or recently was in touch with somebody who traveled.
You may go ahead with your second question. Okay, while we await the resolution of the technical... Yes, Mikey, yes, you may go ahead. Go ahead.
Okay, right. I would like to get a little background into how this case was identified. I know the minister was brief in what he said, but I just want a better appreciation as to how he was identified. The minister said that he presented symptoms. Was those symptoms presented at the casualty, or was he admitted at the ward at any time?
Noel, address those.
Thank you, and good afternoon to all. So my role, as you realize, as the head of the clinical management team is just to refer to your clinical questions that the minister and other personnel from the ministry are unable to answer. Now, this gentleman initially presented to the emergency room after he had a little difficulty breathing, a little discomfort, following exposure to chemicals that he was using for his routine work. So he was subsequently treated. He later had some progression of his symptoms for which he presented to the emergency room, and evaluation was done, the appropriate radiographs was taken, and a rapid testing was done to screen the patient for COVID-19. That initial test was negative. Remembering that a patient presenting with respiratory symptoms can be from many different etiology, of which one of them can be COVID-19. So that's the reason why everyone entering the emergency room have to go through a screening process to determine the risk factor for COVID-19 respiratory infection. So following the screen and the negative test, he was admitted to the ward, but the test was repeated, came back positive, and the patient was quickly transferred to the isolation unit where we do manage the COVID-19 patients with severe acute respiratory infection.
Thank you very much, Dr. Noel, for that response. Mikey, do you have a follow-on from that? Okay, Kristalina?
Okay, my question is to Minister Tito. Is in relation to Saturday, there was an announcement of an easement to the business and so for the next day, for 3 days within this week. With this case possibly being community spread, would we see a retraction of that which you would have made that announcement to? Would we see that you're calling back persons or asking persons to remain home?
Well,
That's one of my questions.
we continue to ask persons to only leave their home if absolutely necessary. The difference between last week and this week is simply that the groceries which were open last week and the banks which were open last week, we did it in a more coordinated and regular basis to avoid any of the jamming up or lines that were occurring, which technically defeats the whole purpose of us trying to maintain physical distancing. So as I had said on Saturday, up to then, the 10th of this month was the last positive case, and we were looking forward to the 14-day, which would have been on the 24th. So this week, like I said, the only difference is the days and the coordination to have everything open at the same time and on a more regular basis. And we have seen the positive results of that today, where there were no lines, as far as I'm aware, at almost all of the establishments that were open, and that will continue again on Wednesday and on Friday to allow people to access, as I said, food and finance. This result now does give us a setback if within the next couple of minutes, or at least by 5:30, the results that we get, if those PCR results come back positive, then technically, based on the science, the clock starts again for another 14 days, which would be another 14 days before we can look at any further easement. But the control, the curfew, the request to stay in shelter and only leave your house if it is absolutely necessary for food or finance.
Kristalina, do you have another question?
Yes, I do. Is there any possibility of a release of the name of the company where that individual would have worked?
No, at the moment, no, it is not beneficial to do that. The company, the employer, has been contacted, and the employees have been contacted for the purpose of contact tracing. What we have found, not just in Grenada but elsewhere, that sometimes there's a stigma or so attached. And I've seen other companies who seem to have been accused making press releases, which we welcome, to say that it is not their company that the individual worked with. But at this point in time, no, there isn't a benefit in releasing that. Although I have seen on social media various names being circulated also. From the ministry's standpoint, we do not see the need to give that name out.
Kristalina, you may go ahead with your third question. Go ahead.
Out of an abundance of caution, was there any requirement from persons who that individual may have likely come in contact with to perhaps say confine themselves or report in any way? Or has there been any anything along that path?
Both of those, yes. To confine themselves and to report any change, but very quickly those individuals will be tested as well.
Sherry, you may ask your question.
Good afternoon. My question, I don't know either of you can answer. What I would like to know that the minister has alluded to the fact that there has been different scenarios on social media. I guess the panic button has been touched as we talk the possibility of a community spread. What action would the ministry be taking now in terms of dealing with the population, in terms of a calm, based on the information that has been circulated, now that we reached the issue of possibility of the community spread?
Well, I think that the message remains the same. Avoid unnecessary circulation, but most definitely maintain physical distance and the wearing of some form of face cover, with the possibility of community spread, and also in an attempt to prevent community spread. It is essential to wear the appropriate face cover, and also, more importantly, maintain social distancing. If this is done with the discipline, then we significantly reduce, if not remove completely, the possibility of community spread or further community spread, if indeed this is the first instance of that.
Go ahead with your second question, Sherry.
And just for the benefit of the general public, in terms of reiterating, it's the Ministry of Health position at this time in terms of handling the possibility of the spread.
Should there be community spread, and we would be making certain decisions based on locations, and yes, there could be a possibility of restrictions, but most definitely there would be increased testing and increased enforcement, zero tolerance, literally, of the wearing of face cover and of social distancing. I think many of us, many of you out there can see that this is no different to what is being said in many of the other countries where they are successful in reducing or stopping community spread or minimizing or lowering the curve, as we say. It is most definitely through social distancing and the wearing of face cover, as well as increased testing.
Minister, there's a question. Actually, this question is for Dr. Dolan. Health officials have said that the rapid testing kits are 100% accurate and 99+% specific. Can you explain why the first test of COVID-19 number 15 case was negative?
Very good question, and I wish I can answer that. But I must tell you that every test have what you call a sensitivity and a specificity. The sensitivity is the ability of the test to be positive if the person do have the infection. And the rapid tests have a sensitivity in the 90s. So if that test is positive, there is a strong likelihood that that person may have an infection. Now, the specificity is a little lower in that it can be negative in someone who has infection. But the specificity, again, is very, very high. What we have to understand is that the rapid test is detecting antibodies. Now, when we have an infection, be it a bacterial infection like a pneumonia or a viral infection like the flu, our body has a defense, our immune system is going to mount a reaction to fight whatever that pathogen is. For example, if you have the flu, your body is going to your immune system would make antibodies to fight the flu. So if you're infected by that same strain of the flu, you already have antibodies to protect you. However, the next flu season, you can be infected by a different strain. Now, the reason why I'm saying that is to tell you that the rapid test is detecting antibodies. And there are two kinds of antibodies that you make in response to an infection. If you have an severe acute respiratory infection secondary to COVID-19, your body is going to make IgM antibodies, which is the antibodies to help you fight the acute phase. And then your body is going to make IgG antibodies, which is going to remain in your system to protect you against further infection with that strain of the virus. Now, you won't make antibodies on day 1 or day 2 or day 3. Usually, you have sufficient antibodies level for detection by the rapid test around day 6 or 7. Now, bearing in mind I said that the test is highly sensitive. It has the ability to detect an infection if one is present, like in the case of our gentleman. It could be that one of the kits may have been faulty, but the people who did that test have done many of that tests. Because since the test was introduced into the community, the wards and the emergency room, Princess Alice, Princess Royal, we screen everybody who come in with symptoms, influenza-like illness, meaning a fever or a cough, and onset within 10 days, or acute respiratory symptoms, or even gastrointestinal symptoms. So they're very experienced with doing those rapid tests. So it must have been possibly a faulty kit, and there is always errors. And I doubt this one is human error, as those people have been doing that on a daily basis.
Let me just add to that no, health officials didn't say that the test was 100% accurate at all. And in no way are we using the test as the determinant for the presence of COVID-19. As Dr. Noel said, and as I said, the test is another form of screening. So the health team used all of the tools that they had at their disposal. They used the rapid test. They also used the X-ray. And it was into the X-ray that they began to see positive results. And then they did another screen, which is the rapid test again. And also we are awaiting the final test, the one definitive test that we rely on, which is the PCR. We did another test this morning. Again, a brand new test that we have that gives results in 90 days that is quite accurate as well. But we rely on the benchmark being the PCR test, which takes almost 5 or 6 hours to be done, but is the industry standard. It is the only test at this point in time that is approved by Pan American Health Organization and WHO. All the other tests that we would be using, we will be using as a form of screening to help us determine. But the final and only test that we rely on is the PCR test.
I should mention as well that the rapid test, as I said, is very sensitive. If it's positive, there is an infection there. But if that test is negative, and we have a strong suspicion from the clinical presentation and the radiology and all of that, that the person has COVID-19, that person will be isolated and they would have the PCR test, because the PCR is actually picking up the genetic material of the virus.
Thank you very much for that comprehensive response to the question from Callisto Faria. Minister Steele, there's a question here from Linda Straker. How many persons are currently in quarantine or isolation because of our latest COVID case?
Well, in terms of isolation, there's just, you go ahead, Dr. Noel, on the isolation.
In terms of our isolation unit, and our isolation unit is for the clinical management of the patient who have severe acute respiratory infection secondary to COVID-19 infection. To date, this is our fifth patient we had admitted to the unit so far. We have 3 patients discharged. The last patient was discharged on Saturday, and this new patient was admitted right after. So currently, we have 2 patients warded and managed in the isolation facility at the St. George's General Hospital.
And in terms of those that are in quarantine, as of 3:30, when I spoke to the team, they had somewhere between 55 and 70 individuals that had been contacted and told to quarantine themselves and await further instructions from the ministry with respect to them possibly being tested as early as tomorrow, depending on when they interacted with the individual, and further later days, and also to observe whether they develop any symptoms or not. That number quite likely would increase as time goes on.
Thank you, Minister. Any further questions from the journalists? Okay, Kristalina, I see your hand. Go ahead.
Okay. I have 2 questions at least. I don't know if the minister perhaps have answered one of them before, but the first question is pertaining to the individual for whom we await the result. He has been in connection with a cargo vessel. Can you confirm?
The individual did work on a vessel, yes, or assist in the offloading of a vessel. The crew of the vessel are also going to be tested, and all those related or who interacted with, yes.
Do you have a follow-up, Kristalina? Go ahead.
Yes, I have a question. There was one patient remaining at the COVID treatment center last week. Was that person released? I don't know if you gave an answer to that prior.
Dr. Noel did.
Kristalina, Dr. Noel just spoke to that very thing. We'll move on to Mikey. You had a question?
Yes, I do. As it relates to the casualty and given the critical nature of what happens there, would we be implementing mandatory testing of persons who are being treated at the casualty?
Thank you, Mikey, for your question. There is a protocol for screening. Now, as it stands currently, all the contacts of that case in question will be screened. And those contacts are not going to screen just with rapid testing. If they develop symptoms, they will have the PCR, which is a lot more sensitive and specific. Now, then comes the healthcare workers. All the healthcare workers will be screened. Those on the clinical management team, those in the emergency department, they would all receive screening at some point in time.
Go ahead, Kristalina.
Okay, one last question though. For the persons in quarantine, has there been any security provided for them?
For their own protection or to make sure that they stay in quarantine. They are being communicated to on a regular basis to ensure that they are maintaining their quarantine. I would say what we have found is most of them are very much willing to maintain that level of due diligence and discipline. And we interact with them to make sure that they have absolutely no reason to leave their place of abode. And if they are living with other individuals, the appropriate arrangements are made, most definitely.
Mikey, my apologies. I only saw your hand just as I threw the floor to Kristalina. So if you had a follow-up, you may go ahead.
Okay, I'm seeking clarity, all right? And forgive me. In terms of persons who are going into the casualty for treatment, will we have mandatory testing? Now, I hear the word screening, and I do not know what screening means. So I just want us to be a little specific with that one.
Right. Now, there's specific criteria for testing. And if I may walk you through, anybody presenting to the casualty or any healthcare facility with an influenza-like illness. An influenza-like illness means a fever greater than 38, onset within the last 10 days or so, or cough, will receive testing. Anyone presenting to the emergency room or any healthcare facility with a severe acute respiratory infection will receive testing. Anyone presenting to the healthcare facility with even a gastrointestinal illness will receive testing. So there will be mandatory testing for anybody with respiratory symptoms, regardless of the risk of exposure to a contact or so, they are going to receive mandatory testing.
Dr. Noel, there's another question here from Callistra. Can you explain the drug management protocol for treatment?
Thank you, Callistra. Very good question. Now, if you look at all the protocols like the World Health Organization, the Centers for Disease Control, the European Center for Disease Control, they will all tell you that there is no approved or recommended drug regimen for treatment of COVID-19. However, there are a lot of clinical trials coming out of Wuhan, China, coming out of South Korea, coming out of Italy, and there was even an interesting one coming out of France. And many institutions and organizations have used those preliminary results to adjust and influence the treatment protocol. For example, the WHO have this very large trial ongoing And a clinical trial is where you test a drug to see the efficacy of that drug in treating a particular illness. And there are stages that the clinical trial go through. Now, the trial involved testing of several drugs. One of them is hydroxychloroquine in combination with azithromycin. And it's on the protocols of many institutions. There are two studies, one coming out of Wuhan, China, and a smaller study from France that attested the efficacy of that treatment regimen. In China, for example, a combination of lopinavir, ritonavir, which is Kaletra, has been tried. The success is a little bit debatable because there's some trial that did not show significant improvement. In a lot of centers, they're using an antiviral medication called remdesivir, and remdesivir is still in clinical trial, and it is showing some good results so far. So the World Health Organization, huge trial that is spread across internationally many different countries, the Solidarity Trial, is testing all of those drugs. The hydroxychloroquine with azithromycin, the Kaletra, the remdesivir, and also interferon alpha with the Kaletra as well. So this is an ongoing study. And until we have those results, we cannot say definitively from evidence-based guidelines. And evidence-based means that there is evidence in the literature, in the research to support the use of your regimen until we have that result. Now, to date, there are over 300 clinical trials going on to test the efficacy of many drugs. About 90 of them going on in the US, a lot in China, some in France, some in Italy, and many different countries. I should say that all countries, including Grenada, can sign into the WHO Solidarity Trial as well. The reason why it is difficult for us to do it as a small country is that when you enroll your patients in a clinical trial, randomly, they can be assigned to get the treatment drug, or they can be assigned to get something called a placebo, which is just standard treatment. And we're small, our numbers are small. If we enter the trial, some people may just be getting the standard treatment, which is not the medication. So our treatment protocol also involves a combination of hydroxychloroquine and azithromycin, which to date have showed some good evidence in the major trial, one of the trials from Wuhan, China, the French study, and it's on the protocol of many, many different institutions throughout North America and the rest of the world. So these people also have other complications, like most of them may have sepsis, they may have superimposed bacterial infection. Our treatment protocol takes into account all of that. But to date, it is still a trial and error until we have definitive evidence from the ongoing research that this protocol is superior to another protocol.
Thank you, Dr. Noel, for that response. There is another question from Linda Straker. How is screening done? Is it a blood test or the nasal swab? And can a person refuse the test?
If someone presents with respiratory infection to an institution, no contacts, low risk factor, then they can have one of the rapid testing done. But I must tell you that just like tuberculosis, if we diagnose somebody with tuberculosis, tuberculosis is highly infectious and it's a disease of public health concern. They cannot refuse treatment. If you strongly suggest the history, your examination, your investigations, strongly points to the fact that somebody have COVID-19, we're mandated to isolate that person and treat that person because this is a disease that is also a public health concern. If the person go out there and they have active COVID-19, a severe acute respiratory infection, they would infect the whole chain of people. So this is a disease of public health concern where they're mandated to receive treatment. If you have a flu-like illness, the patients have autonomy as long as they have decision-making capacity. You explain for them the benefits of doing the tests. You explain the risk of doing the tests. And as it is in medicine, they can refuse. But when it is a disease of public health concern, you can mandate somebody to receive the test. At least that is my knowledge, and that is how we practice for conditions like tuberculosis and all of that.
Kristalina, you have another question?
Yes, just reverting to my previous question in terms of security. The minister had answered on one aspect of it, but going back to remembering what patient zero relatives would have faced in terms of, the community reaction when they found out, about that case. The security of the persons in quarantine, their safety and security, what, if anything, is being done to protect them?
The safety and security of all of our citizens is always the concern and the mandate of the RGPF. And if at any point in time there is a threat, as there have been with some of, as you have implied, with some of the other patients, it will be addressed appropriately by the Royal Grenada Police Force, as it was previously.
Do we have any other questions from the media? Dr. Noel, I just saw an interesting question here from online in terms of the time span between the negative and the positive tests. Can you tell us what that was?
It could have been maybe about less than 90 minutes. Yeah, less than 90 minutes. But as I said, if a test is positive, strong likelihood. But if a test is negative and you as the clinician have a strong suspicion, then you repeat that test or you go on and you do the PCR. We'd go on and do the PCR for confirmation anyway.
Just let me add there a question. I thought it would have come up, but for Dr. Noel to answer, because I did ask it earlier. When the patient was moved from casualty to the ward, as you said, what sort of condition or face cover? And so I think that may be a concern for people.
Fortunately, we have universal use of face masks for all the healthcare providers because you treat everybody as COVID-19 positive until proven otherwise. By that, I simply mean we observe universal precautions. So the people evaluating the patient, the doctor evaluated, the nurse evaluated in the emergency room, use the personal protective equipment in the form of the mask, the N95 mask. The patient on the ward was evaluated by one of our senior medical officers who used her personal protective equipment. None of the junior doctors were called in to evaluate that patient at all. As if you have a strong suspicion, you don't expose them. And the doctor who accompanied the patient to the isolation facility was in his full personal protective equipment. So everybody, except to be quite honest, there was only one person who breached that rule, and that person is currently on mandatory quarantine and monitoring.
There's a question here from Kenroy Batiste. Pardon me, I didn't have the opportunity to read it before. But he says, I note that you said contact tracing is on the way to determine whether the latest individual interacted with any of the persons who were previously confirmed with COVID-19. Did the latest individual show up at the hospital alone, or was he accompanied by another individual? And if so, has that other individual also been tested?
Well, contact tracing, I'm the clinical man. The contact tracing is not within my realm. The contact tracing is done from the surveillance department and the community health department. And I must say that they have been doing an excellent job since the onset of COVID-19. But what I can say as a clinician, I myself, with a member of my team, got the information from the gentleman as to who he came into contact with, and that information was immediately filtered to the surveillance department of the Ministry of Health. No, the individual did not come to the emergency room on his own. The individual was driven to the emergency room, and the individual voluntarily provided the name of the person, and he cooperated very well with the healthcare providers in providing information of all who he has been in contact with.
Thank you, Dr. Noel. Any closing comments from the gentleman? Dr. Noel, maybe we can start with you and then wrap up with the minister.
My closing comment, again, I'm here as a clinician, and I talk as a clinician. I just want to appeal to the Grenadian public, and you've been hearing that from the Minister of Health to the Prime Minister to everybody in the media, that they should not let the guard down, they should not become complacent, but they should maintain the safe distancing, and they should always wear a face mask in public, be it their own homemade face mask, but wear a face mask in public. I want to urge the elderly people, because as we have seen in Grenada here, it's most of the elderly people who became severely ill and had to be admitted to the isolation facility. I want to urge the elderly people who have other chronic disease like diabetes, hypertension, chronic obstructive lung disease, asthma, sickle cell disease. Please take your medication during this era, because having one of those conditions for some reason is going to worsen your clinical course if you do become infected with COVID-19. So please listen to the authorities. I think the RGPF have some very good structures in place. Listen to the maintain your safe distancing. Don't be too hungry for a social gathering. Sometimes the sacrifice is worth the end. We do not want a whole catastrophic event in Grenada. So let's all be safe. Elderly people and people with chronic disease, take your medication. Listen to the authorities. Maintain safe distancing. Wear your face mask in public. Remember to wash your hands and sanitize as frequently as possible. If you go to the supermarket, sanitize. You use the trolley, sanitize. Please, let's try our best to help the country and to improve the health of the nation. Thank you.
Yeah, in closing, I want to say that today we are awaiting 18 tests. The soonest that those tests will come back would be somewhere about 6 p.m. As soon as we do have results, we will make an announcement on social media. Because I know, I'm sure the nation, like myself, we're waiting on one of those test results to see what it is, but there are 17 others that are pending for today that we'll all receive at the same time. So we are proceeding. We will give you the information as soon as we get it. Apart from that, I want to end like I have ended on most days, simply to thank the team. Fortunately, today I have Dr. Dolan Noel here in person, so I can thank him in front of the nation again for the wonderful job that he has been doing there in managing the team, as well as ensuring the safety as best as possible of all who come under his control, whether patient or his staff or his team members. Also, there are other unsung heroes that are always out there, and every day we take a time to mention them. As always, the rest of the health team, island-wide, the RGPF, as always, but today as well, the solid waste management team that are going about their duties, and our prison officers as well, that are making sure that task is maintained, and they are in a risky position as well there. So to just take this opportunity to mention them and to recognize their job, their sacrifice of coming out while the rest of us stay at home. And while we continue to say, anytime we come out, we're putting ourselves at risk, there are some who continue to come out just to make sure that the various wheels of this nation that are necessary to keep moving. And also, most definitely, the retail staff at our groceries, shops, and supermarkets that have been putting themselves at risk to maintain the order where there were lines, but also to make sure that we get access to our food supplies. I want to thank them all of the companies, all of the individuals, all of the sole traders, small shop owners, and all of those who are delivering behind the scenes to keep this part. And also this week too, we have our bank employees that have come out as well, again putting themselves at risk, but to make sure that those necessary wheels of the nation keep turning. Maintain your social distancing. We can and will win this battle only as a united front, only if we maintain that discipline, and only if we wear our face cover when we are in public. Thank you.
Thank you very much, Minister Steele. And with that, we come to the end of this afternoon's press briefing. My parting words to you today, as the Minister just alluded, the fight against COVID, it will not be won by the Ministry of Health, by the Royal Grenada Police Force, or any other body on the front line. Our success in the fight against COVID depends on all of us. We all have the power to take actions that can curb the spread of the virus here in Grenada. The recommended protocols have been stated time and time again. Physical distancing, your hygiene, constant, frequent washing of hands, proper sneezing protocol, and wear your mask or face covering when in public. I am Press Secretary Philomena Robertson. I thank you so much for joining us here this afternoon. And before I leave, I just want to say a special thank you to Mrs. Michelle Braffett of the School for the Deaf and all of the other sign language interpreters who have facilitated the press briefings for the benefit of that community. Do have yourselves a pleasant afternoon.
With all that's happening with the new national party, NNP. Send us a message via text or WhatsApp on 405-8683 with your name, email, and constituency. Stay in the know with NNP. Get updated.